Hey, good afternoon, everyone. Thanks. I'm going to try to talk over this music. So my name is Milan Patel. I'm a respiratory specialist at Trillium Hospital. I've been at Mississauga for 16 years, started my career here, and I'm really excited to be a Mississauga resident. One of the things I love talking most about are the lungs and how we breathe. You know, we take in 7,000 liters a day, 21,000 liters of air, 7 liters a minute, 21,000 liters of air a day. We take 21,000 breaths in a day, 7 million breaths in a year. And if we live till age 80, we will have taken 500 million breaths. It is amazing the work that our lungs can do. But our breathing is special. It's one of the few organs that allow us to both autonomically control and voluntarily control this action. I don't know if anybody can think of any other organs that do this, any other muscles that work automatically as well as voluntarily. Anybody know the other muscle group? Blinking, and maybe a little bit of the top part of your swallowing. And so it's special, but yet we walk around not really paying attention to our breathing. We don't take advantage of the fact that we have conscious control of our breathing. We walk around with shallow breaths all the time. So I want you to think and do this little exercise with me now. Everybody take in a deep breath. Okay, thank you. Do that again. In through your nose, out through your mouth. Okay. What muscles moved when you took a deep breath in? Yeah. What I noticed is what I see with all my patients all the time. Is the first thing we tend to do is lift our shoulders and our chest. But where does most of the breathing occur? It's actually our diaphragm muscle, right? So when we breathe in, our bellies should do what we don't want to do because we don't want to be embarrassed by our fat stomachs. But our belly should stick out. And we need to mindfully do this all the time. Every time you're sitting around, you're stressed, you're working, you're happy. Take a belly breath. So the other thing I want you to do is this little exercise to feel what it feels to be like a lung patient. Okay, take in a deep breath. Again, breathe in. Again. That discomfort you feel, breathing at that top level, is what our patients feel all the time. It's an awful feeling. So what do we do when we see these beautiful lung tissues? They're fragile yet resilient. In these lung tissues, air passes through the vocal cords, through the trachea, into these little alveolar sacs. We have 500 million of these sacs between our two lungs. If we laid out the lungs, they would fit the length of a tennis court, or the entire width of a tennis court. If we take the tiny air passages from the lungs and put them side by side, they would stretch the distance of 2,500 kilometers. That's from here to New Brunswick. So it is this amazing organ. But when patients have shortness of breath, it is not just about the lung tissue. The breathing system, in fact, extends all the way up to our brains. We have parts of our brain that perceive how we feel. We have sensors in our arteries that tell us if there's enough oxygen. We can have disruption in our breathing system through the blood vessels that feed the lungs, that come out of the lungs, the muscles around our chest, the bones, the diaphragm muscle, the lining of the lung can be a problem. So there are many different places where we can get issues with our respiratory system. So when you come to see a respirologist, we are very simple. We don't have fancy gadgets like Dr. Nav. We have really this simple little tool called a spirometer. It is cheap. It does take expertise to do it well and to do it often and to be accurate, but it is quite inexpensive. This device, which is almost medical grade, would be about $200. And all you have to do is, first of all, find someone that has one, and that's sometimes hard. It is hard to get to a doctor that may be able to do spirometry because of some of the technological issues and the quality and infection control, but it's not. But we have to think about this. It's a really basic test. We don't need to jump to a CT scan. So all you have to do is take a big breath in, belly out, and you blow out as long as you can. And our little computer screen will measure how much air is going in your lungs, how fast that air is leaving your lungs. And that real little simple measurement can tell us so much about your health. Spirometry is most useful for letting us know about diseases of the airways. The most common diseases of our airways are asthma, COPD, and this lesser-known disease called bronchiectasis. But many people walk around calling this my allergies. It's just a cold. It's just a cough. And we don't really recognize that we have something that's wrong that actually can be fixed. There are studies in India that suggest that 70% of patients with severe asthma have yet to be diagnosed. In India, there's often a stigma around the title of asthma, the label of asthma. And perhaps that stems back to the day of tuberculosis. And so patients don't want to use that word. They often, unfortunately, most patients will not take their medications on a regular basis for their asthma. We have the same problem globally. And so when you come to see us, one of our big jobs is to actually teach you about the medications and how to use the medications and why you need to use them, and try to make a pretty convincing case that they can help. But we want to meet you halfway. We want to know what's important to you and whether you can actually use these drugs. Sometimes we need more information, and therefore we would go on to some fancy images. We'd send their patients to our radiologist for a CT scan. CT scans are helpful at looking at our airways, but they're often used to look at our lung tissues. Those, not necessarily the alveoli, but the tissue that's holding the alveoli together. And we use CT scans for all kinds of diseases, infections, fibrotic conditions of the lungs, which is another uncommon disease, but becoming increasingly common in this country, especially as our population ages. And it looks like, as we see all this new tech, that this is pretty straightforward. You run them through a CT scan machine, we take a couple of questions, and we should know their diagnosis. But unfortunately, it's not so simple. There's so many things about the lungs, because they take in all this air every day. They're exposed to so much that we often have to do a lot of homework to figure out what is it that's triggering the lungs to act this way. And so a lot of our jobs as respirologists and as physicians in general is to act like detectives. We do need to know what was your job. In fact, we need to go back even further. Were you born premature? Did you have a childhood illness that could have left you with scarring? Did you have childhood measles? Did you come from a country or grown up where cooking with biomass was done inside the house? Where is there a lot of pollution? There's so many things. And then what was your jobs in the past? Not just your last job, but maybe 3 jobs ago you worked at a factory that you were exposed to chemicals. So these things are very important, but often very hard to ascertain. So what we ask when our patients come to us, and as generally as you guys as patients, for any of your problems, it's really helpful if you come in and bring in notes and say, these are what I've been feeling. Don't put your interpretation with that. Don't assume, I had a cough, I had a pneumonia. Just say, I had a cough, and it went on for 6 months. And these are the different medications I tried. I tried this antibiotic, I tried this from the pharmacy, I tried this natural medication. This one helped, this one didn't help. Because all of this information, we can work together with you as a patient partner to try to figure out what is the cause of your problem or what we can do to help reduce the severity in the future. So what we really want to do is move away from when you come to see us and assuming that I'm just going to tell you what's wrong with you. What I really like to know is what's more important to you. Is it important? A lot of patients come to us and all they want to know is, am I not dying? I'm not dying. And if that's all you want, hopefully most of the time I can tell you that. 99% of the time I can tell you that. But there's many patients that say, actually I'm not disturbed, it's my children that keep bugging me to go seek medical attention, or my spouse or my partner. And that changes how we approach things, because maybe we have to also talk to them. Or maybe your concern is that you don't actually want to tell me the truth because you're maybe embarrassed of something that happened, or you're afraid of the label of asthma and you don't want to be given that label. And you don't want to take these medications because of a fear you have. And if I don't know that, all I can do, I'll miss it. And I'll give you a prescription and you won't use it. So as we get into more technology, I actually am so excited for the future of machine learning and AI, because maybe it can sit in the background and do the easy work, the computer formula to tell me what your diagnosis is, and you and I can have a real conversation about what's bothering you. So I really think a fundamental part, and I think Trillium and our region believe this, that medicine is not just a drug. Knowledge is medicine, food is medicine, exercise is medicine. All of these things are so critical to keeping our lungs healthy. We learned already in the earlier talk about cancer prevention. It's the same for every chronic illness. We don't need a specific recipe for cancer. We don't need a specific recipe for cardiac disease. We need to apply holistic principles. And so I come back to the breath, because to me, the breath is the most important bridge that connects everything we do between our mind, our body, our activities. I think there's so much that we can learn from the Vedic Indian system, science and knowledge that's so old. In the future, as all this technology advances and sits in the background, maybe we'll actually go back a couple of millennia and learn about mind, body, spiritual connection. I think it's important we all remember that mind and mental fitness is important, that physical and dietary fitness is important, that social and spiritual fitness is important. And so I encourage you all to, every time you walk down, you take a turn, you watch your TV, take a conscious breath, and remember how important that is. And remember that physicians do have a role to help you when you can't breathe, that we do have tests. Don't ignore your symptoms. Thank you.